ده بعيد. So finally it started working, huh? So let us begin our class on medical terminology. Now that you people are part of the medical fraternity, first of all, let me welcome you to the medical college, all of you. And I hope, inshallah, that you will be becoming very good and an expert and very sympathetic in having a human heart inside for the patients, inshallah. Myself, I am Dr. Muhammad Salahuddin, Associate Professor in Physiology, here in Saudi Arabia since about 2001, working in Qasim University for 10 years, then Sulaiman al-Rashid University for 3 years, then I joined this university and college last year. Anyway, can you hear me? No. That's the problem. Yes? Me? Yeah, you can come here. Come here, please. I will try to shout as much as possible. It will be a bit difficult for the people sitting in front. I'll be shouting for them, but I hope you can hear me. Can you hear me now? Yes. Okay. You know, when you are going to study any medical book, whether it is physiology or anatomy or any topic or any handout given by the doctors here, you are going to come across lot of words, lot of terms which are basically Greek for us. You know, there is a saying in the English language, it's Greek to me. So it's like that. It is literally Greek for us. Why? Because most of the terms, most of the diseases or conditions, they are coined, they have been made, they have been framed using Greek and Latin words. Okay? Greek and Latin words. So literally also it is true. And because something is Greek to us, Greek means here we are literally unable to understand what this term means. So this lecture or this class has been kept primarily to try, because we cannot fully tell you all the medical terms. There are thousands and thousands of medical terms. But we can try at least to help you, because you are very new here, to understand how you can read and how you can, from the word itself, try to understand what is the meaning of this particular term. Like I have told you, all the diseases and conditions and other phenomena, even names of substances like enzymes, etc., they are made, they have been coined according to a specific way. Okay? This language or this method, which has been adopted by all the doctors all over the world, this language is called as the language of the health profession. Language of the health profession. Why health profession? Why not only doctors? Because, you know, in a hospital, there are not only doctors who are working, isn't it? There is a whole team. There is a whole team which is taking care of the patient. And this team comes under the umbrella of the health profession. So everyone should understand what you are writing, isn't it? You are a doctor, a patient comes to you, he tells you about his problems. You understand something, isn't it, according to your knowledge and your expertise. Then you write some investigations for him, do this blood test or do that X-ray, or go to the radiology, get an MRI or CT scan done, and then based upon those investigations, you arrive at a conclusion, which is your diagnosis for the patient. Isn't it? Diagnosis means what he is suffering from, what you think that he may be suffering from, he may be having this problem or that problem. Now, when you are writing all these things, the signs and symptoms, okay, and then finally what you think is happening to him, after that, when your turn is over, because you're not going to be there in the hospital for 24 hours. Usually, as you must be knowing how the hospital works, it works 24 hours around the clock, but at the same time, you are given a duty of 8 hours. So you are working in shifts, isn't it? So you will be there for 8 hours, another person will come for 8 hours, and so on and so forth. So whatever you have written, whatever your workup of the patient was, it should be legible and it should be comprehensible. It should be understood by another doctor who is taking your place, isn't it? Do you understand my point? So your diagnosis, for example, he is having myocardial infarction, or in investigations he is having hypoinsulinemia or hematuria, terms like this. So what I am writing hematuria. When you come take my place, you should, upon reading, you should immediately understand, okay, this patient is having hematuria, so now we have to continue this dosage and we have to maybe change this or do that, right? For this, the Greek and the Latin words, they have been chosen from the beginning. Now why so? Because, you know, one of the scientists and doctors, he was many things, called as Hippocrates. You know Hippocrates? Hippocrates was he lived about 2,500 years ago. 2005, and he is called as the father of medicine. Okay? So, because of him being a Greek person, so most of the terminologies, we are still sticking with it, the Greek and the Latin terms. So that was sort of an introduction. Today's learning objectives, we will be trying to break up, to decipher the terms. Yani, basically we want to see what they are made of. Once we understand that, maybe we can, upon just reading a term, maybe we can then understand what the term means. For this, we have to study what they mean. Okay? Define a given list of biomedical terms. Briefly describe the root, prefix, suffix of the biomedical terms. What these things mean, what is the root, what is prefix, what is suffix. Understand combining forms. Okay? Because there are terms in the medical field which are not alone. You have to combine maybe two terms together, or maybe sometimes three terms together. So how we combine them? What are the rules for combination? So combining forms and etymology. What do you mean by etymology? I wrote the definition here. Etymology simply means, you know the meaning of the word or the part of the word logy. Logy means study of, right? That means study. So etymology is study of words. Okay? Study of words. And how they originated, what is the origin of the word, and how the word evolved or how it changed over the years. A word may have started 2000 years back, and as the language evolved, or as it goes from country to country, that word may change its meaning. Okay? So evolution of the word. So etymology is that. Origin of a word and the historical development of its meaning, how the meaning changes, how it evolves, and their common usage. Medical terminology is a special vocabulary, like I have told you, used by healthcare professionals for effective and accurate communication. Why do we need effective and accurate communication? I have given you an example just now, isn't it? What you have written, it should be understood by the other doctor. That is how we can take proper care of the patient. Otherwise there will be chaos. Because it is based mainly on Greek and Latin words, medical terminology is consistent and uniform throughout the world. If you write hematuria here, and if the patient is not satisfied, maybe, or maybe he goes into complications and maybe his family is having lots of money, So they may want to go to America. So they will take the papers with them. Doctor in America, when he sees your reports, he should immediately understand again. So not only another doctor in the same hospital, a condition may arise where he may go from here to Riyadh or from Riyadh to America, things like that. So it will be consistent throughout the globe. Let's come back to the word itself, the medical term itself. Every medical term, okay, or almost all medical terms, you can say that they are made up of three parts. One will be the root, another will be the suffix, and third will be the prefix. Okay? Now, very easy to understand the meaning. I hope most of you, I think you are fairly good in the English language. I take it. You are understanding what I am saying? Yes. And you also know basic words like these here. A root is the fundamental unit of each medical word. That is why it is called as the root. What is a root? Every tree is also having a root in the ground, isn't it? Yes. The tree is supported by the root. If there is no root, there will be no tree. Yes. Similarly, every word will have a root. Okay? And the root is the fundamental. Fundamental means basic. Yes. Basic. Okay? Basic unit of each medical word. What's a prefix? Something. Pre means before. Isn't it? Before. Prefix, a part of the medical word or term that you attach before the root. Okay? Before the root, that is called as a prefix. Similarly, a suffix is part of the word, or it is a word part which is attached after the root. Are you getting my point? So three things clear, inshallah? Example, learn. Learn is a word. Okay? Now if you add ER as a suffix to it, it becomes learner. Will the meaning remain the same? No. You add two alphabets and the meaning changes. You add a suffix to it and the meaning changes. Learn means to learn, to study, to get knowledge, isn't it? Learn. The process of learning or learn. Learner is the person who is learning, isn't it? So you add a suffix, ER, and the term changes. Now same ER, you make it RE and attach it as a prefix to learn, which is relearn. Yeah, again, yes, to learn again. So you understand the concept of root, suffix, and prefix. So this is a very simple example, not a medical term example. This is just to understand root, suffix, and prefix. This I have already told you about. This guy Hippocrates, who was Greek, father of medicine he is called as, and hence almost 75% of the medical terms are based on either Greek or Latin words. Only the newer, recent maybe since last 50 years or 100 years, these terms are being introduced which are English in origin. Okay? So almost 75% are Greek or Latin. Starting with the root of the word, root, word roots or combining forms. Okay? Like I have told you, when you use a single root for a word, that is simple. But if you use two word roots, which we will see later on, that leads us to combine two roots together. Okay? So word root or combining forms we will see it, gradually. Usually indicate body part involved or a type of disease or procedure. The word root in the medical term, if you look at the word, if you look at the term, the root in the word, usually it will mean what? It will mean a part of the body, okay? Or a type of disease or procedure. But mostly it is part of the body. The word root is taken for part of the body. For example, cardiology. Okay? So cardi is the root, which is heart. Logy is the study which is the suffix, isn't it? A word root may be used alone or combined with other elements to complete a word. Again, the same example we can use of cardiology. Okay? Always remember that a medical term can have one or more root words. One or more, we will see. Okay? Just right now, for you, just remember that root may be two. That is what I told you in the beginning in introduction, that a medical term, a simple medical term, will have one root and maybe one prefix and one suffix. Okay? Or one suffix. Bigger medical terms may have, not usually, two roots and one suffix or one prefix. Okay? You will see. We are going very fast, mashallah, because we are very quickly understanding what I am saying. Example here, having one or more word roots, cardiothoracic. Do you see here how many parts are there? 1, 2, 3, 4 parts are there. Cardi related to the heart. So this is root. Like I have told you, root basically most of the time indicates the body part. Okay? So cardi here is the root, first root. Thoracic is the second root. Cardi, heart, that which is the organ of the body. Thoracic or thorax means the chest of the body. Okay? Cardiothoracic. I'll complete. Cardiothoracic. So this word just I put here to explain this particular sentence, this particular statement. That a medical term may have one root or two roots. I gave you one term initially, cardiology. It is having only one root. Cardiothoracic, it is having two roots. Are you getting my point? You said how? When you have two roots, how? Yes.
The roots come alone in the words or must have prefix or suffix?
Yes, usually it will have either a prefix or suffix. A root alone will mean nothing, isn't it? It will only mean that organ. Yeah, but a very valid question. Very nice. But usually it will mean nothing, isn't it? Because root means, like for example, cardi or thorax. Yeah, if I say thorax, okay, you understand. I am saying thorax means the chest. But what about the chest? If I say thoracic, that means related to or pertaining to or something is happening in the thorax. Okay? Are you getting my point? Yeah. Not must, not must. It is not a must. I am saying every term will have a root. It can have two roots, can have. And it will have either a prefix or a suffix. One of them. Okay? One of them. Sometimes both of them. That is the thing. I mean, there is all sorts of permutations and combinations here. So let me put it more clearly. A medical term will have a root. It may have two roots. It will have either a prefix or a suffix, or it may have both. So the biggest medical term will be what? Biggest medical term will be a term which is having a prefix, two roots and a suffix. Isn't it? That is the biggest medical term. Are you getting me?
Yes.
Isn't it? And a shortest medical term will be having a root and either a prefix or a suffix. Got my point? You cannot, everything is open.
How can I recognize the first root?
The first root is the first word.
How can I recognize if you don't know the word?
Cardiothoracic is a word, for example. And what you have to remember is a root will usually indicates a body part or a body organ. Okay? So when you know that a root word basically or usually indicates a body part or organ, then you know, isn't it? You know here there are two body, one is a body organ and another is a body part. Okay, or you can say both of them are body parts. You're not wrong when you say this. So cardiothoracic, heart and the thorax, heart and the chest, both of them are body parts. So there are two roots. Now which is the first one? The one that is coming first is the first one. Some examples of word root. Okay, this you can study at home. I don't want to waste time. These are just examples. Dent means tooth and lip means fat, because lipid or lipolysis, okay, or lipogenesis, okay. So all these things you can study at home. Again, these are other examples of the word roots, different from the ones which I have given in the previous slide. Now, in my presentation, when you see the presentation, it is about 40 slides. Or by 40, yeah. But don't worry, okay? Why I have increased the number to so many slides? Most of the slides either are having only 2-3 lines like you have seen in the previous slide, or examples for you to study at home. Okay? Just go through the lists which I have put here. That will help you, inshallah, in recollecting and really retaining, remembering later on also what we have been discussing here. So this is another example. Word root, what is the meaning of the word root, okay, and what is the word analysis. So word root, for example, here, as you can see, skin here, mouth here, right? So there are different terms like derm also means skin, cutaneous also means skin, okay? Stoma or stomat also means mouth, or also means mouth. Like for example, oral, oral cavity, or giving a medicine orally. Take this medicine orally, right? So, or also means mouth, and stoma also means mouth. Okay? Neph related to the kidney. Ren or renal, as you must be knowing, renal also means kidney. Neph also means kidney. Basically, neph is being taken from the nephron, which is the unit of kidney, isn't it? So that is how you have to be careful about. Here I have put examples of, those were examples of the body, yani kidney and skin. Here in medicine, you are going to come across words which are not related to the body, like as you can see here. Now what are these? These are used for substances. Used for substances. This is biochemistry, isn't it? So a substance can be hydrophilic or hydrophobic. So hydro is the root here. Okay? And this means water. Hydro means water. Example, hydrophilic. And what is the meaning of that? It means attracting water or attracted towards water. Hydrophilic. Philia means attraction. Phobia means fear. Means it will be away from that. Phobia. So phobic, hydrophobic will be opposite of hydrophilic. Okay? So on and so forth. I will not read every one of them. You can read them at home. Okay? Shall I go on? Word root example related to studying. Okay? In the previous slide, I had given you word root example as far as the profession of medicine, as far as a doctor is concerned, related to the body of the patient. Okay? Now that finishes the word root. Let's go to prefixes. Like I have told you, word root is usually indicative of, when you are talking about a medical term or disease or patient, usually the word root is indicative of a body part, isn't it? It can be indicative of a disease also, it can be indicative of a procedure also. And like we have seen in the previous slide, when we are studying something, gaining knowledge, like for example inorganic or organic things. So when we are studying biochemistry, we will have different word roots. They will not be related to the body, they will be related to the substance that we are studying. Okay? Similarly, prefixes usually indicate location, time, number or status. Okay? Usually indicate what? Location, time, number or status. How? Now you know that prefix comes at the beginning of a word. You know that already. Like for example, pericardium. Where is it? It is around the heart. This is location. Right? That is an example. So peri is a prefix. Peri is a word part which is used for a prefix. Peri means around. Perineurium, around the nerve. Perimysium, around the muscle fiber. Pericardium, around the heart. Something around the heart. Pericardium, what is around the heart? It's a layer. It's a layer of tissue which is on the outside of the heart. All of us have it. That is called as pericardium. Now, can you tell me the root here? Cardi, right? And at the same time, can you tell me the suffix? Isn't it? Is the suffix. So this is a word which is having all the three things. It is having a prefix, it is having a root, and it is having a suffix. Isn't it? So this is a prime example of a medical term. Pericardium. Peri, around the heart. Now there is another word. Pre or pray. P-R-E. So don't be confused with this, okay? Usually I found during my experience of these years that students are confused between pre and peri. Pre or pray, both of pronunciations are correct, is before. Before. Okay? Before that. Pre means that. Okay? Pre-finals, before the finals. Peri-finals, around the finals. So there's a difference, okay? Now, there can be negative prefixes like a, okay? Like anosmia. Anosmia means inability to smell. This person cannot smell at all. A means absence, total absence. Example, anosmia, anuria, no urine. Okay? So there are many terms like that. Anoxia, no oxygen. So no means negative, right? So negative prefixes are all these are negative prefixes. And this is the meaning of that, what it means. Anti like antibody.
When I say
Contra like contralateral. Yani not on this side, the lesion is on this side, the problem is on this side, but the effect is on the other side, which is contralateral. Okay? So there are two terms. One is ipsilateral, another is contralateral. Ipsilateral means the lesion in the brain or in the spinal cord is on the right side. Suppose this is the right side of the spinal cord.
Another side
Affected.
the opposite.
Okay, the lesion is on the right side, and if the right side is affected, then that condition is called as ipsilateral. Ipsilateral. Ipsi means same. And when the lesion is on the right side, but the left half of the body is affected, that is called as contralateral. Contra. Opposite. Okay? Negative. Are you getting my point?
This is the stage.
So, no, I am trying to explain contra. I am trying to explain contra. Okay? Day. Again. No, not there. Or dementia, for example. This.
This is abnormal.
Yeah, all abnormal. So these are prefixes. Disembowelment, for example. In. Okay? Insomnia, inability to sleep. Cannot sleep. That patient is having that condition in which he cannot sleep. That condition is called as insomnia. So there is a prefix. What is the prefix? In. In. Non and un. Okay? All these are negative prefixes. Then there are prefixes for colors. Okay? Like, for example, there is a condition called as cyanosis. Or there is a cell called as erythrocyte. You must be knowing about that. Leukoplakia, another condition. Melanin, another pigment. Okay? Xanthoderma, another condition. Now here, all these are colors. Cyanosis. is the bluish discoloration of the fingernails and the mucosa because of something going wrong with the heart or with the lungs. So all these prefixes, cyan, eryth, leuc, mel, melan, xanth, all these are color prefixes.
Is it same to a meaning? The and without without.
I don't get you.
The prefix.
This one?
Yes, it's
Uh-huh.
been without, and it's been also without.
Yes, yes,
So
yes.
it's same.
Yeah. Okay? So prefixes for colors. Are you getting my point? Shall we go ahead?
Yes.
Prefixes for numbers. You know this, isn't it? Mono, di, tri, tetra, poly.
Yeah.
You know this.
Yes.
Prefixes for numbers.
Yeah.
Example. Prefixes for direction. Yeah. See. Abduct, adhere, dialysis, percutaneous transfusion. Now in anatomy, for example, you will come across motion in locomotion or in action of the muscle. Okay? So flexion, extension, abduction, adduction. Okay? Now the prefix in abduction is AB, abduct. Remember, inshallah you will not forget this, ab is from the word absence. Absence means away from, a student is absent in the class. That means he is away from the class. Okay? So keep this formula in your mind. So you won't be confused between what is abduction and what is adduction. Is it towards the body or is it away from the body? Okay? So remember absence, away. AB, absence, away. That is the formula. So abduction is movement of the arm away from the midline of the body. This is abduction. And this movement is adduction. Add, come together. Okay? So I hope you will remember, keep this formula in your mind. So, but we were talking about prefixes. So AB, ab, is again a prefix for direction, isn't it? It's a direction away from the body, direction towards the body. So abduction, adduction. Adhere, another example, AD, for AD, add. Adhere means to stick together. Okay? To stick to one another, like the platelets do when you have a cut. So adherence, towards or near. Dia, per and trans, all of them means through. Okay? Like dialysis, percutaneous, through the skin, or trans, like transfusion, through the vein. Transfusion is given through the vein, isn't it? Through the IV fluids which are given through the IV line, isn't it? So these are prefixes for direction.